Hello everyone, I welcome you to this gastro session. So here we will be talking about conditions in gastroenterology. I will not going to discuss in detail about all the conditions. I will be telling you the bare minimum that you must know when this condition is asked. This can be useful for undergraduates, and if you are preparing for USMLE, this is the must know. So let's get started. So first, what is by Peutz-Jeghers syndrome? Peutz-Jeghers syndrome is associated with the two important components. First one is that there will be hematomatous colonic polyp. What do we mean by the word hematoma? Hematoma means that tissue which is original for that area. Say here that we have hematomatous colonic polyp. That means we have the colonic tissue which is proliferating in a disorganized manner and forming polyps. So, but if you ask me, since it is the same tissue, colonic tissue, but in a disorganized manner it is proliferating. So, but if you ask me, will they turn malignant? No. It is a pre-malignant condition, but there is a chance that they can turn malignant. So, Peutz-Jeghers is not malignant. That is the first point you should know, and it is associated with hematomatous colonic polyps. What about the second one? It is also associated with perioral melanosis. What does perioral melanosis mean? In the lips and surrounding the lips also, there will be hyperpigmentation. You can see black dots or sometimes black. Overall the black can be extending over a particular area. So when all that is associated, so even when seeing the patient waiting for you, or even when you see someone else with a perioral melanosis, you can suggest them to go for a colonoscopy because they might have a chance of Peutz-Jeghers syndrome, and it is a hematomatous colonic polyps. This is about our first condition. What about the second condition? The second one is about the Osler-Rendu syndrome. So if you remember this name, it might be confusing. I would better advise you to remember HHT, that is Hereditary Hemorragic Telangiectasia. So as the name says, it is hereditary. Hereditary can be because of either autosomal dominant or autosomal recessive. So this is an autosomal dominant condition. Hemorragic telangiectasia. Why is the telangiectasia hemorrhagic? This is because the vessels, the blood vessels are not formed properly. The artery as well as the veins, there are interconnections. Arteriovenous malformations happen. Therefore, the telangiectasias are present, and it is obviously hemorrhagic. That's what the name says. So how will the patient present with? They will be presenting with epistaxis because of the hemorrhagic telangiectatic vessels that are present on the nose, which might bleed, resulting in epistaxis. Secondly, because of this arteriovenous malformation, they can even have a high output cardiac failure. Thirdly, they can even similar thing, arteriovenous malformation, it can leading to telangiectasias, and it can also result in bleeding in the gastrointestinal tract, and that they can present with anemia. So these three are the important components of Osler-Rendu syndrome or hereditary hemorrhagic telangiectasia. Now let's see about one more condition, that is the Plummer-Winson syndrome. What is Plummer-Winson syndrome? Plummer-Winson syndrome is associated with three important components. The first one is that there is spider web in the esophagus, so therefore they will be having dysphagia. The secondly, they will be presenting with koilonychia, that is iron deficiency anemia will be present, which is obvious with the koilonychia. Thirdly, they can also have angular cheilitis because of the deficiency. So all these three components are associated with the Plummer-Winson syndrome. Sometimes a peculiar feature, that is pica, eating or consuming clay or else rice, so a tendency to consume that, so that can also indicate the iron deficiency anemia. So with this we have covered in brief about the three conditions. Thank you.